Hi there, good day. Welcome to this presentation for nursing staff at Elim Park on using non-pharmacologic methods of pain management in your practice for your patients. I want to express my gratitude and appreciation for you taking the time out of your busy schedules to participate in this education project with me. So let's get started with the purpose and intention of this presentation. So my focus and purpose in delivering this education to you is to provide formal, effective, evidence-based, non-pharmacologic means of pain relief in a way that aligns with the current practices and policies of Elim Park. My hope is that this presentation will offer a more in-depth knowledge on offering these methodologies, best practices in delivering the care per evidence-based research, and realistic, attainable means of utilizing these skills in your current practice for the benefit of your patient's experience and to improve desired healthcare outcomes in pain control and self-management interventions. As a fellow nurse of over 12 years, I can appreciate how challenging it can be to incorporate additional interventions to your individualized care plans. The aim of this presentation is to ensure that interventions being encouraged are sustainable and they're teachable to your patients for autonomous use and allow for an enhancement of your current practice versus having this weight that would create undue stress during your shift while delivering high quality care to your patients. By learning more efficient means of implementing these interventions, the hope of increasing their use without a perception of being a burden is a crucial component when attempting to incorporate positive changes in your nursing practice. Because in the end, change is change. And the truth is that more recognition on and emphasis on non-pharmacologic methods of pain relief and individualization of patient care plans are the focus of the Joint Commission. Yes, I said the J word. These methods strongly resonate with their standards of care and pain management and flow with the upward trend of incorporating a more comprehensive approach to pain control. And we all know how crucial that is. So here's a brief overview of the main points in this presentation. We'll start by defining the need for increasing the use of these effective modalities by using a needs statement to provide some context into the current perspectives and views on pain management in the older adult population. Simple, quick, and easy mindfulness techniques that can be used for all patients experiencing pain will be covered. Some of us already do this naturally in our personal and professional lives. Nurses are some of the most compassionate, empathic healthcare professionals in the field. These techniques will highlight key strategies to offer evidence-based support in a way that comes across as genuine and nurturing to your patients, or even friends and family. Effective environmental interventions that take less than a minute to deliver will be reviewed to reinforce concepts of mindful strategies and serve as quick go-to techniques that have proven to make a positive impact. Then we'll move on to the chosen methods of non-pharmacologic pain management, which are meditation, music, visualization or distraction, and aromatherapy. After describing these methods, their proven effectiveness, and how to properly implement them in your nursing practice, we'll wrap up this presentation with a brief summary of key points as a conclusion. In current modern medicine practices, the use of opioid-based analgesics and other forms of pharmacologic pain control still take precedence in pain management over non-pharmacologic pain management, as these methods have saturated the public through various media outlets for decades. A normalization of pharmacologic pain management has been achieved by this constant exposure and their perceived effectiveness. Non-pharmacologic methods of pain management have increased in the Western world, mainly in part to the demand in accessibility and acceptability by patients. With a focus on ethical, culturally competent, evidence-based, patient-centered care, providing access to a broader, more comprehensive pain management care plan in the older adult increases positive outcomes and satisfaction rates associated with effective means of pain relief according to nationally recognized standards. The integral component of increasing education among nursing staff on the availability and the use of non-pharmacologic means of pain reduction for quality improvement can not only increase patient satisfaction and desirable healthcare outcomes for the patient, family, and staff, but also reduce costs associated with expensive pharmacologic pain relief methods, improve population health, and enhance the experience of staff through deeper connections with their patients, which aligns with the quadruple aim in healthcare. As I mentioned earlier, these techniques could very well be things that you've been doing for years naturally through your passion for empathic, compassionate patient bedside care. However, I'm here to assure you that these techniques are more than just a personality trait you possess. With the demand of typical nursing shifts, it can be a challenge to stay mindful of our hurried, rushed movements and quick, sharp tone. A lack of mindfulness in these areas tends to translate as dismissive, disrespectful, rude, and abrupt to many patients in experiencing a heightened sensitive state as a result of their pain. Using soft tones, quiet movements, and culturally appropriate therapeutic touch when communicating and interacting with your patients conveys respect and acknowledgement of their needs for a nurturing, calm demeanor while providing quality care through their pain experience. Positive verbal usage is a phrase to describe the influence of verbal suggestion in the management of pain. The inclusion of positive affirmations, positive expectations, and the use of positive wording showed the potential to induce expectations, which may generate decreased pain using the placebo effect, and a possible decrease in pain perception. A study that resonates well with this ideology is a chronic pain study proposing a mid-level theoretical explanation for patients who can cope well with chronic pain compared to those who do not. Several factors were identified as relevant to the acceptance of their state of health. Using classical grounded theory methodology, these identified factors included the patient making sense of their pain, deciding to convert from a patient to a person and move on with life, and flexibly persisting occupational engagement and coping where applicable to develop future plans. In this model, the theory states a diagnosis should be accompanied by positive messages, which help to shape perspectives on hurt versus harm, and the realistic need for a lifelong approach at managing a chronic issue. Remaining supportive, conducting acts of kindness, and demonstrating compassion allow the patient to feel unique and cared for. Encouraging active life engagement and providing positive motivation is absolutely recognized as a legitimate and ethical means of providing support. Again, although many of us have used these interventions for providing comfort, inducing relaxation, and pain reduction many times in our nursing career for our patients, reinforcing these simple, quick, and easy concepts can make all the difference to your patient's care experience, while enhancing the connection and rapport you have with your patient. It's suggested that instead of waiting for the patient to prompt us with a need for a change in their environment for their means of comfort, these interventions are offered prior to leaving the patient's room. By offering to adjust the lighting, draw or open the shades, adjust the temperature, the patient can be made to feel a level of customer service that is appropriate in the healthcare setting. The feeling of being cared for by way of offering comfort is something we can all value. Also, making the bed as comfortable as possible by arranging bed linens and pillows or helping the patient change into comfortable clothing provides another means of conveying a feeling of, dare I say, pampered? It might be a little too strong because we've all heard that crude statement, this is a hospital, not a hotel. Although that phrase holds literal truth, it represents the quality of customer service offered at hotels and how impactful it is in our experience or how it meets our expectations of care. Patients have similar perspectives on the care they should receive in a healthcare facility. For many patients, like ourselves, the extra step of simply offering is enough to induce a feeling of being genuinely cared for, beyond mandatory interventions. Using these environmental interventions moves us past task-based nursing in a way that truly doesn't take more than a minute to offer and a minute to deliver. By this time in our modern day Western society, many of us have heard about the benefits of meditation. In fact, the number of people practicing meditation regularly has tripled since 2012, and it is the second most popular mind and body practice in the United States. The benefits are seemingly countless. Some of the most widely recognized and proven include improved memory and brain function, reduction in blood pressure, improved sleep, the slowing or prevention of some neurodegenerative diseases like dementia and Alzheimer's, stress and anxiety reduction, reduced symptoms of depression, weight management, improved attentiveness and concentration, increased social connectedness, and an all-around strengthened immune system. That is honestly only a fraction of the stated benefits across several studies. When speaking on our particular topic of pain relief, meditation has proven to be extremely effective in all types of pain, including chronic. Meditation studies have demonstrated a reduction in the intensity of pain by approximately 40% and general discomfort by 57%. Comparatively, morphine and other opioids demonstrated a pain reduction of only 25%. Another study found that those who practiced mindful meditation reported higher pain tolerances than those who did not meditate. Meditation comes in many forms. The form it does not come in, however, is the stereotypical one most Americans perceive it to be. This time-consuming, painstakingly cumbersome, ancient Eastern art form performed by Eastern spiritual figures. Meditation is a non-offensive practice and does not belong to any one religion or culture. It's an individualized practice of creating an internal awareness to achieve peace or enlightenment. People have reported giving up on meditation because they believe long periods of time are needed every day to achieve a notable difference. But in fact, it's been documented by many sources that consistent, short burst sessions of only 10 to 20 minutes per day is all it takes to begin noting differences and experiencing the positive outcomes of the practice. Mindfulness-based stress reduction and mindfulness-based cognitive therapy have been increasingly used as chronic pain interventions. Formal meditation is the central technique in mindfulness-based stress reduction. Mindfulness and meditation use among adults with chronic pain decrease levels of perceived stress related to their illness and improved pain outcomes. A comparison study featuring mantra meditation versus music listening in older adults experiencing chronic pain stated various levels of positive outcomes by practicing either modality for 15 to 20 minutes, twice a day for 8 weeks. Core outcome measures included knee pain and knee function, perceived osteoarthritis, perceived stress, mood, sleep, and health-related quality of life. Both groups demonstrated great improvements in all core outcomes after implementing the given interventions. Although of the two, mantra meditation demonstrated greater improvements in sleep, quality of life, and overall mood. Mantra meditation and music have been shown to decrease stress and stress reactivity, sleep impairment, anxiety, depression, fatigue, and sympathetic arousal, all factors which are linked to increased pain sensitivity and severity. An interesting correlation has been made between both mantra meditation and music listening to the reduction of pain-associated fear of movement, a factor linked to the progression and developing of chronic debilitating pain due to osteoarthritis. And there's a common reluctance to engage, as there is a common reluctance to engage in physical activity among this population. These studies suggested 15 to 20 minutes twice a day of sitting comfortably with eyes closed in a quiet environment, with or without the use of guided meditation. Mantra meditation technique is a simple, easy to use or easy to learn meditation practice. A list of possible mantras, sounds or words, can be found easily through the use of technology and an internet search or YouTube. Selection of the mantras should be based on the patient's appeal and based on the sound or vibrational quality, and to avoid mantras that might precipitate trains of thought or emotional responses. These sessions can be guided or silent. You would instruct the patient to take a few deep breaths, releasing any stress or tension during the exhalation, then to begin silently repeating their chosen mantra, gently letting go of all their thoughts for 15 to 20 minutes. Emphasis should be placed on the practice being easy and effortless. After 15 to 20 minutes has passed, the patient can stop repeating their mantras and sit quietly for approximately 2 minutes before opening their eyes. This is a patient-led but nurse-guided method and is completely individualized with endless variability and is determined by the patient's willingness and desired participation. By no means should this method be strongly encouraged against the patient's current perception of its effectiveness. Simply provide the evidence-based education and allow the patient to show interest or request assistance in learning how to practice meditation for the multitude of benefits, particularly pain reduction. As mentioned in the meditation section, the effects of music listening noted positive desired patient outcomes by effectively reducing knee pain and dysfunction, decreasing stress, improving mood, sleep, and overall quality of life in older adults with chronic osteoarthritis. The study goes on to claim that the reductions in pain and overall improvement in function noted with music listening were similar to or greater than those reported in previous trials of medications commonly prescribed for osteoarthritis, including NSAIDs, acetaminophen, and opioids. They also state claim that the improvements in mood and quality of life observed surpassed the documented effects in previous studies on the use of yoga, Tai Chi, physical therapy, exercise, and other non-pharmacologic therapies in older adults with osteoarthritis. A study on the effect of music listening on pain and range of motion in older adults after a total knee replacement states that patients who listen to music for 25 minutes during one session of CPM and no music during another session of CPM in the same day for a total of 2 days showed a significant decrease in pain level. In addition to pain reduction, the study demonstrated an improvement in joint range of motion in this patient population. Recommendations in the type of music used are slow tempo, low tone, and soft melodies to include classical music, instrumentals, gentle percussion, and nature sounds. Music intervention is recommended to remain under 30 minutes per session for at least 14 to 30 days, using patient-controlled volume and music selection. Studies reviewing non-pharmacologic means of pain relief in the older adult were conducted to include visualization, distraction, and guided imagery techniques, and those reported satisfactory reductions in pain intensity immediately after implementing this intervention. An added component is the sustainability and suitability of this practice in the older adult. These interventions can be independently implemented on a continual basis, which demonstrated pain reduction upon follow-up assessment. Patients express these interventions to be desirable whenever they experience pain, as this method is always available to them and can be performed in an autonomous fashion. This resonates strongly with the concept of self-managed care in the chronic older adult patient, and that's something we strive to diligently encourage. In these modern times, technology has penetrated just about every generation alive today, so it's not unheard of for elderly patients to have access to a smartphone or other personal viewing device. There are infinite YouTube videos, especially formulated with images or active scenes intended for a therapeutic effect. With so many variations available, including downloadable apps, recommendations for patient viewing can include ocean waves, running brooks, flowing rivers, aquatic animals, nature images, or video loops, or just simply watching TV, which speaks to the distraction piece. Even with the absence of technology, imagining a peaceful, serene location and envisioning relaxation and bliss are also effective classic means of visualization. With the risk of stating the obvious, just talking to the patient if desired by them or providing some activity of their interest can be categorized as distraction. When the focus is on pain, the perception of the pain intensifies. I'm sure we can all relate to that concept on a personal level as well, or we've seen this in others. As soon as the person is aware of their pain or they see their injury, the pain intensifies greatly based on a report by the individual and often cascades into higher levels of severity with each moment that's spent on focusing on the pain itself. Stress reduction, decreased pain, and relaxation are the key outcomes when using this method. Aromatherapy is a means of non-pharmacologic pain management that has been used widely and is offered at various healthcare settings for quite a few years now in this country. I was thrilled to hear that Elim Park has a policy on the use of lavender, which yields so many benefits to one's health. This oil will be the sole focus of this section in order to remain aligned with your current practices and potentially reignite the intended use of this uncomplicated and speedy method of pain reduction in your patients. With this effort in mind, I would like to share a study which was conducted researching the application of complementary therapies during rehabilitation as it pertains directly to your patient populace. Aromatherapy was used by occupational and physical therapists during sessions. Outcome measurements included pain interference, pain severity, mobility, and social integration. A greater reduction in pain severity from 6 months to 1 year was noted over those who did not receive aromatherapy. Although there was no noted correlations between the use of aromatherapy and mobility or social integration among this particular patient pool, there was notable association with the amount of time the patients received complementary therapy during sessions and the reduction of pain interference noted at 6 months and the reduction of pain severity at both 6 months and 1 year follow-ups. As for the list of proven outcomes, lavender, when used in aromatherapy, is believed to promote relaxation, reduce anxiety, depression, nausea, and pain. When this method is used and breathed in by the patient, the scent transmits messages to the limbic system, which influences the nervous system and helps to regulate emotion. I just want to add a quick disclaimer, which is aromatherapy differs from essential oil use, as this term typically describes the topical or ingestible variations. So please just refer to the guidelines that you use at Elim Park to ensure compliance with your facility prior to using aromatherapy with lavender oil for your patients. So that actually brings us to the end of the presentation on medically evidence-based benefits of highly acquirable, easy to deliver, time-efficient, non-pharmacologic methods of pain management, which can be utilized in your current nursing practice at Elim Park. Maintaining mindful techniques, offering environmental adjustments, encouraging meditation practices, using music, visualization, distraction, and aromatherapy can elevate and enhance the care you provide to your patients and provide a level of enlightenment which is ever growing in emerging healthcare trends. With a personalized medicine approach, which is where treatment plans are tailored according to the individual characteristics of patients, standards of individualizing care planning and patient-centered care can be met. Non-pharmacological approaches to pain are effective, especially when 2 or more methods are combined. Utilizing as many evidence-based non-pharmacological methods of pain as possible by staff and as applicable to the patient and as desired by the patient can be effective in reducing pain reliance on PRN pain medications and improve patient-desired outcomes in healthcare. I hope I've ignited the desire to implement these methods with your next opportunity. If you're interested in learning more about any of the studies featured in this presentation or related resources, I've included them after this slide with the links. The post-education evaluation survey mimics the pre-education assessment in format and length. I cannot thank you enough for taking the time to not only gain some education on a viable resource for your practice, but also to help me on my journey of continuing education. I wish you all the best in your professional and personal endeavors. Thanks.